Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video is going to be about iliotibial band syndrome, or IT band syndrome, or ITBS. And I laugh at that because, people, these syndromes and things that people come up with, it's looking at what is the cause of it, what is the function of it, and what could cause this syndrome or this inability for the muscles and joints to work and operate properly. So first, IT band goes from, well, just generalize, it comes from the hip, goes down and inserts on below the knee. So if the ankle or the knee or the hip or even the lower back isn't functioning properly, it can cause irritation to this muscle, cause it to function improperly, and give you this IT band syndrome due to friction that is built up on the muscle when it's supposed to be moving smoothly. So if you think about IT band syndrome, is the second most common cause of knee pain in runners. Now I know you're sitting there thinking, what's the number one cause? Look it up, and you can find it on Google in about 2 seconds. And we can also help people with that cause. But right now, let's stick with the IT band syndrome so there's no confusion. But if you have a foot that is over-supinating, or even over-pronating, but over-supination is going to be the most common thing for a runner, that can cause stress into the ankle and turn off the peroneal muscles. And it can also cause issues to the gastroc, soleus, or the calf muscles. And then coming up, when you look at the glute muscles and the piriformis muscle and the sartorius, all these muscles that attach to the pelvis going into the femur can make a difference for the IT band. So, this week's handout talks about this. And the other thing in thinking about IT band syndrome is what I lecture about all the time. I'm like a broken record. Use the foam roller. Use the foam roller. Should I use it before or after? Just use it. Use it before and after. That would be fantastic. So if you have an acute case of IT band syndrome, meaning it just started up within the last 24, 48 hours, I would ice. I would not be using heat on it at that point. Once you're past 48 hours, then I would ice for 10, heat for 10, and ice for 10. So as far as checking for it, when someone comes in, we do 100 different neurological tests, and we're going to check all the muscles around the ankle, including the extensor hallucis longus, which is going to extend the big toe, which is slightly important for runners. And then we're going to check the popliteus muscle, which locks and unlocks the knee. And then we're going to go up into the hip and check all the 4 quadriceps. We're going to check all 3 hamstrings on both sides. We're going to check all 3 glute muscles on both sides. We're going to check the piriformis muscle on both sides. And people are amazed at what is not working on their body. Even these athletic people who exercise and work out all the time. And they can't figure out sometimes why. Why am I having this pain? Why is it only on one side? And finding balance for the body and helping them function better. So that's this week's video. And I look forward to whatever I'm going to do next week.